I'm Dr. Monica Carezani-Gavin at Azani Medical Spa. I'm interviewing board-certified plastic surgeon, Dr. Lam. Welcome.
Thank you very much.
And I would like to ask you, who is the ideal candidate for eyelid lift or blepharoplasty?
Sure. I get many patients that come to my office for consultations for this, and I would say majority of them would say to me, you know, I just have tired-looking eyes. I'm not a tired person. I'm very energetic. But because of some skin redundancy or excess, especially on the upper lid, they feel that they look more tired than they appear or that they feel. And on the lower lids, most people complain of the buildup of some fat that would bulge out, causing a little contour defect, as you will, that they don't particularly like, especially if they review their younger, photos. Those are the ideal candidates to get rid of some excess skin from the upper eyelids, and also to remove some of the excess unwanted fat from the lower lids.
Okay. And can you briefly explain the procedure? What happens during the operation?
Oh, sure. For the upper lid, as I mentioned before, it's the majority of the procedure is to get rid of all the excess skin that's involved. So preoperatively, prior to going to the operating room, I would mark the patient of how much exactly the excess skin that they have to remove. During the procedure, that excess skin is removed, and then I also explore underneath if they have any excess fat that has developed. We take care and get rid of that as well during the operation, and then reclose the incision, which incidentally lays right across the natural eye crease of the patient.
So the scar is not...
It's virtually invisible. Yeah.
Okay.
And then same thing on the lower lid, because the spirit of the operation is to remove fat. We make incision on the right underneath the lash line. We explore all the pockets where the fat can develop, and we remove those pockets and basically redrape the skin, take off maybe any excess that may be existing, and this incision also heals almost imperceptibly.
Wow, wonderful. And what can a patient expect during the recovery period?
There's a great question, and one of the things I tell patients is that, believe it or not, this operation involving the eyelids, it's virtually painless. Now, most people find that very surprising because it's such a sensitive area, but in my experience, it is virtually painless operation. Again, we recommend a pre-op medication for arnica to decrease the bruising. So I always tell my patients they're going to look somewhat worse than they feel. There's always a little bit amount of bruising. There's not going to be zero. Their vision should be absolutely unaltered, and it's basically a week or two before the bruising starts to really dissipate.
So then most patients would take about a week off, and then hopefully if everything heals appropriately, then go back to work after a week.
Absolutely, very reasonable.
Pain-wise, not so much.
I got to tell you, the majority of my patient doesn't even require pain medication.
Excellent. So mostly just the bruising.
Absolutely.
Yeah. All right. Well, wonderful. Thank you for your time.
Thank you.